Sure, why not? Um, let's get going. Can you hear me?
Yes, we can hear you.
Okay, perfect.
We can't see you. We can only see your Game of Thrones icon.
Yeah, I know. I know. Just want to keep it light. Okay, I'm Dr. Cavazos. I'm a clinician scientist in epilepsy. I want to make you aware that this webinar is being recorded, so don't say something stupid. That's okay. You can chat and you can ask questions if you want to be, a little bit more privately or more anonymous using the chat. I have a few questions that some of you have um, sent us. Thank you for participating in that manner, and thank you for taking time out of your day to participate here. I only have 10 slides, and essentially I have here it is, the first one. Now I need to put it on. Okay. Um, let's start with the beginning. This is a very unusual time. That's an understatement. We have never had something like this in terms of MD PhD applications or medical school applications in this kind of setting. It's something that is affecting everybody, some people more than others. People who are in communities that are considered hotspots, they are communities that certainly are having many more difficulties. There are some communities like here in San Antonio where we have had COVID-19, but we really don't have a significant burden of disease. We have changed our social distancing. We have a stay at home order, but we have been very fortunate on not having many deaths, not many cases, despite adequate amount of testing. So I'm an assistant dean for the medical school and the graduate school, and I sit in the leadership of the hospital as well as the medical school, and I have been hearing all the plans and participating in all of the plans forward. So I'm very keenly aware of the circumstances in terms of how many people we have in ventilators, what is our number of available ventilators in San Antonio, which is many, over 80%. So we have a lot of capacity if there is a second peak or a second surge. Unfortunately, for some people in other cities, that's not the case. In that way, we were fortunate. Now, I also sit and I'm the chair elect of the Association of MD PhD programs. So I have been very active working with many groups, AAMC, AMA, MBME, and others to try to solve the issues that students are facing. Your group is facing issues of diminish research experiences, diminish ability to take the MCAT, and you may feel that you are inadequate. Well, everybody is in the same boat. So we are going to have to be flexible. And, part of the reason why we're doing this webinar, and we plan to do additional webinars to follow up, is we're going to have to be flexible this year. And the one interesting thing is that, we are all trying to work together to keep the pipeline going. Okay, so let me start with, it took me back to the last slide. So let me start with the first slide. So who am I? Let me show you what my real picture it looks like now. I am in a t-shirt and I'm at home, and there are days that here it is, I am home in a t-shirt and I'm talking to all of you. So, um, we as physician scientists, we have a blessing of being able to do research and do clinical work. And clinical work inspire our research, and clinical work um, makes our research models much better. Simultaneously, the ability for us to bring these discoveries to practice is one of the accelerating things that happens. Tomorrow, I will be in the hospital. I do have clinical days, and I'm a neurologist. I am a professor of neurology, neuroscience, and physiology, and as I said, chair-elect for the AAMC MD PhD section and the National Association of MD PhD programs. And yes, I have to use suits every so often. Now, uh, the purpose of this webinar is to address questions. And some of the questions have been coming from you, and please use the chat. But if you want to, freelance a question, I'm here to answer them. I'm not going to hide away out of them. So we're going to try to support transparency on how this happens, um, trying to lower your anxiety level and stress, and we're going to get you this uploaded into the website. Let's start with the MCAT. Can applicants, so let's talk about the timeline. The timeline is AAMC has open AMCAS. AMCAS is available for you to be writing things and practice and, rehash and print and give it to friends to say, hey, does it sound like me or not? Everybody has a different narrative in your essays, but we are looking for certain things, and on June 1st or so, June 4th, somewhere in that range, AMCAS opens the place and applications can be submitted and go into this dark hole. So one important piece that happens between submitting an application and getting an application, uh, you know, delivered to a program is AMCAS does a process of verification. And that is essentially taking your transcripts and putting numbers into the place that are equivalent, meaning, A pluses are for some people A pluses, but for AMCAS, they don't exist. So they come as A's and things of that sort. So what they do is play the even field for everybody, and they come up with numbers, and those are your academic benchmarks, and those include in order to be verified, you need to submit your transcripts. Okay, so as soon as your transcripts are done, send them to AMCAS. Now, MCATs can be uploaded at a later time. And in the application, there is a piece, a box where you check that says, I intend to take my MCAT, let's say on September 15, 2020, or in July X, etc. Now, keep in mind that the process from taking the exam to getting the exam reported, it's about 4 or 5 weeks. So can you apply without an MCAT score? Absolutely yes, no problem. You can apply to a single school. You can apply to all of the schools. This score is helpful in order to understand the places where you might be able to run. I always have said this to many applicants. One number doesn't define you, multiple numbers do. And so if your If you already have a lower GPA, you don't know what your AMCAS is gonna be, you might be thinking, I'm gonna get a 520, and because I did a practice test that took a portion of that practice test this time and that time, and in the end it ended up being a 520. If you want to do a predictive test, take a real test, one of the double AMC tests, or some of the different ones that they sell you, but put yourself into a room, put the clock, and start ticking and answer the question, so you have a real predictive test in one sitting. To that, decrease the number by 4 points, 5 points. And that's going to be the lower side of what you're going to be scoring. What is the latest for this cycle? So you heard me, it takes 5 weeks to report. We are going to be delayed in this cycle. We are getting the information until July 15. But committees will start looking at those applicants, and generally speaking, committees take 4 weeks or so to discuss an application. In general, we don't forward a applicant to the committee until we have academic benchmarks that are acceptable to my medical school. And so, we do have broad ranges. And believe me when I say we have broad ranges, my medians are pretty high, but we do a holistic review. And so if you want to apply to a single school, and you end up with a low number and you need to reapply or retake the examination, the latest I would recommend will be August. Beyond August, August will be reported already in September, and that means that I will be submitting my application to my committee by October, and so we are having the slots of late October, November, December, January. And so you already are diminishing your circumstances. You cannot change the situation. It is what it is. But if you can take it before August, it will be best. If you are submitting something in July, if you're taking it in July, it's okay. Beautiful. Don't worry. Nobody's going to reject you because of that. If you have special circumstances, reach out to us, reach out to the program directors. It's a two-way street. Interviews. Will all interviews with all programs be online, virtual? Very likely. That is what happens to be the case. This is not mandated by all programs, but we have organizations that have recommended this. And as much as we would love to have you here in San Antonio and come by and see our facilities and talk to our students and have times, etc., we're going to be doing it virtual. We did second visits virtually, so many programs are already experienced on how to do this. And so will interviews be pushed back or delayed? Probably.
When you have a second, there's a question back on the chat for MCATs, back to the previous slide. So just before you continue on. Do you want me to read it to you?
Yes, please.
So for MCAT scoring and taking the tests, is this assuming that no future tests are canceled?
Okay, great question. I don't know the answer to that to an extent that we do not know whether we are going to get second picks. If we have a second pick, testing facilities are going to be in trouble, and we might have disruptions. Okay, um, as it is now, the testing sites have added, well, this is from AAMC, they have added 3 more days, and they have added 1 extra seating. So now there are 3 seats. It used to be only 2 seats, one in the morning, one in the afternoon. Now we have like a 6 in the morning, somewhere like 1 or 2 o'clock, and then one, a little bit later. So we have 3 seatings. We have, because the number of people who can take the MCAT in the facility is gonna be diminished. Notice and realize what's going on in the location, meaning what are the rules and the laws. I suspect that you're gonna be wearing a mask. If you need special circumstances, special accommodations, you need to discuss them. Um, I hope that I have answered the question. If there's any additional comment to that.
Is there any likelihood that the November 1 deadline for applications will get pushed back?
Yes, very likely. In fact, it's not just very likely. I mean, ours will be pushed back from November 1st to December 1st. But some places it's going to be very specific, place specific. Let me just give you a caveat with using the submitting an application until the very, very, very last day. The number you are competing for, a number of interview slots that might be very small. We always try to keep about at least 20% of the interview slots, until the very end, and we make the final decision on who to interview. That has been my practice, at least, not to give as many slots, but we interview once a month, and we'll plan to continue interviewing once a month. Now, will we be interviewing in February? Might be the case. I don't know how the circumstances, how much disruption will be. Even people who are local, here from San Antonio, we will interview everybody virtually for fairness and equity to everybody. So everybody has to go through the same process. That's what we plan to do. One of the things that we do, which is very different than many places, is we ask you to do a chalk talk. Well, this is going to be a video chalk talk. So you need to practice and be ready for that. And, we will be devising how we do this, but that's part of our talk. You're going to be meeting with mentors in breakout rooms. You are where you're going to be one-to-one, and you're giving a 5-minute warning, and and then the only good thing is we can disconnect you. We sometimes, interviews keep going, we get you back into the waiting room, from out of the to the main session, to the main lobby. So we're going to be doing things on time. So start practicing. If you want to be comfortable with interviews, start practicing. That's one of the benefits of knowing how is it going to be. Is it going to be all programs? Very, very likely. Okay. The coalition on Monday, well, actually it was the weekend, the coalition of physicians for physician, or coalition for physician accountability, which is a group of AMA, AAMC, and multiple other locations, has made the decision that we have to do this we have to do virtual interviews, and that's again fair and equitable. One silver lining, you are going to be the group that saves money, because most interviews, you typically have to fare the price of going. So you are going to be able to interview at more places because there's no travel. You just need to make sure that you do uh, read what interviewing virtually is like. um, you need to be wearing something um, that looks professional, and that looks professional into the camera. Make sure that you put a little bit of makeup, but not very reflective makeup. Otherwise, you're going to be shining in. Make sure that the lighting is adequate. Make sure that you are understood. There's nothing wrong with wearing a headset. It may be a good investment. You are likely to be heard better. Make sure that you have a good camera. This camera, sorry, it sucks. It should be on top, not in the bottom of my computer. But it's in back order. So start doing the things that you need to be doing. I do have to do a cable connection. Okay, so even though that I have Wi-Fi and reasonably good Wi-Fi that I can watch movies, the buffering for this thing, particularly when I am the host, is not very good. So I have to use a wire Ethernet connection, etc. So start understanding how the process works. MD only interviews. Our school has two systems of application: TMD SAS for MD only, and the AMCAS for MD PhD. TMD SAS, they have their rules, they have their calculations, they do their entire thing by themselves, separate from us. They can reject you and we can accept you backwards too. Okay, so these are two times at bat to an extent. Um, Now, it's possible that you interview in both places or just MD PhD. If you're a Texas resident and you just interview with us, we're still able to add you, if you indicate that, to the TMD SAS interview pool for matching purposes for the Texas residents. Now, one important thing that I want to make clear, and that is that you need to know that a state of residency does not matter. It does not, it's not better for you for being a Texan, it's not worse for you. It just does not matter. Let's see. It's Texas Medical School and Medical and Dental School Application System. And that is for all the Texas medical schools. And that, but that's a different story. For MD only, all the public schools need to have 90% of their class from Texas. For MD PhD, we have been 80, 90%. In fact, we have been, all of us, all of our class being out of state. This class is a little different because people wanted to stay closer to home, which is about 50%. Okay. Should I stop for questions in regards to this? Are there any questions in the chat?
Yes, we have one question. How is the pandemic expected to impact medical school education, especially during clinical training? What is the expectation on shadowing during the pandemic? Do we expect shadowing to be allowed anytime soon?
Okay. So the answer is less and less likely. That's the truth of the matter. For at least the next few weeks, maybe couple of months. but things are gonna restart. Here in San Antonio, we have our clerkships have restarted, but they are being phased in with shifts so that there is social distancing. We have also done certain things to provide all of our students with some clinical experience. Now, the students who are in MS1 and MS2, they are doing everything virtually. Their things, their labs, everything has been changed to virtual education. In the end, you still need to take the classes, you need to still take the courses, you need to start taking the exams, you need to take the USMLE exams. By the way, the USMLE exams have changed to pass-fail. And furthermore, the USMLE exams have the same level of disruptions as the MCAT exam. So we have some students who are not able to go into they are scheduling their step examination. So fortunately, we have been fortunate to reschedule them relatively favorably in May and June with only a couple of weeks of delay. But um, the applicants who are looking for shadowing experience, it's probably more likely that your PCP, your pediatrician, those people who are not in institutions, they may be able to be taking some students. Now, for MD PhD, we only need 50 to 100 hours total. So if you have done already 50 to 100 hours, you are on the other side of the equation. If you haven't done any, these are special circumstances, and we are gonna be considering you based on those special circumstances. My hope is that by the time that you're interviewing, hopefully in November or whatever, you have had the opportunity to have done that. And so updates, yes, you can update people about your application, update about your experiences as things change and evolve. So we are gonna be allowing updates, and we're not gonna be doing automatic rejects. We're reading every application. We're providing feedback on every application.
Dr. Cavazos, what do you think as far as second look visits for this time next year for the next application cycle? Do you think that those will be virtual, or do you think it's too early to say?
Too early to say. We don't know. The one thing that I can tell you is professional meetings, as they used to be, like ABRICAMS and SACNAS and, my professional organization that was meeting in Seattle. I had a meeting in Toronto. It's gone. I'm actually doing virtual programs like these, for a place that I was going to be going in Mexico. It's just is that way. So there's also disruption in presentations. Having said that, if you had an accepted poster, you can still list it. Don't All of those accepted things, as long as they were accepted, it's okay. Put them in there. What you put in parentheses is disrupted due to COVID-19, period. We understand. The fact that it was accepted, it means that you were able to put it together and put it into a project. And that is increasing the quality of your research experience, okay? Any other question?
Yes, we have two. So it looks like in the Akshata asked, is this 50 to 100 hours of clinical experience in total? So this is going back to shadowing and things like that. As in, does this mean that some of the hours can come from volunteering experiences and other hours can come from shadowing experiences?
They need to be hours of, I mean, the most valuable hours, to be honest, is shadowing a physician scientist. That will be the best, awesome piece, because then you are seeing how this person who is a scientist is practicing as physician. But most of you are going to have only physicians. We are only 3% of all the physicians, so we're not as likely to be shadow. But the more clinical physician, the better. But as long as you have done enough volunteering or some of that volunteering in a clinical setting where there is healthcare being delivered, you're probably okay. The better, we need to justify that you want to be more than just a PhD scientist to the medical school. So give us something before the interview. Give us an update. That's what that's for. Okay. You
Okay.
have more questions?
Yes. I just had a few pop up. Hold on one second. Okay. Do you foresee the effects of COVID-19 having long-term effects on medical education? My understanding is that some industries are pushing for more virtual-based operations. Do you foresee this translating into medicine as well?
Healthcare is changing. I do already video conferencing using Zoom in clinical settings while I'm doing consultations and follow-ups. It's not, I mean, you need to do a physical exam on face-to-face in many circumstances. But will it change the experience? Absolutely. All the outpatient experiences are changing. As an industry, we are gonna become more digital. The reason why we had not transitioned as much is it has to do with how doctors are paid. Telephone calls are paid at, you know, 20 cents the dollar. Video visits are paid at the same level than a um, than a physical visit, but then you remain with the uncertainty of the exam. So you're taking all the liability. And so it has been because of the payers and because of liability that people haven't gotten out of, using pagers, and we are using now electronic medical records, and they are coming with positives and negatives. But reality is, yes, as an industry it will change. Regarding, for example, I do have a setting of virtual reality in this room. Actually, I have two setups for playing video games, but you can do virtual anatomy. In fact, we do virtual anatomy in our school. And that's what we do before you go and dissect a cadaver. But there is a little bit still the need of having the patient interaction. So will the things are gonna be more deliberate, more intense? Yes, but at the same time, medical education will need to get up with the game of digital technology. What else?
So Steve asked the question, is conducting independent survival animal surgeries and research considered clinical at all? Would this be weighted at all if you have low human clinical hours?
Um, the number 1, 2, 3, and 4. is research, quality and extent of research, quality and extent of research, quality and extent of research, academic benchmarks. Oh, at the end, we're interviewing. We need to make sure that we can check this box of clinical experiences. This is the mindset of us, program directors, MD, PhD, okay? So just make something cogent enough that the medical school doesn't bother me, okay? Just have project a level of empathy to, to be a team player, because a lot of healthcare delivery is team player. That's part of what we're looking. You are going to have, as a generation, as a group, you're going to have less research and clinical hours. So be it. So we just need to do the best that we can. Don't delay. If you have what it takes, apply. Let me just tell you another very critical story, and that is in our program. In the last 5 years, we have 4 reapplicants who the next year had, were, they were from wait list to being, admitted, or from not being interviewed to being interviewed and offer an admission. So this is a long career. The good news is all paid off. And when you finish this, you go into residency, and then it's faculty. So everything is paid off. You don't have to worry about many things. 40-50% of my students own property here in San Antonio. More than a quarter of my students, almost a third of my students, have children. So this is part of a longer career. Don't worry about those things. Any other question?
Yes, one more. When will MSTP candidates have to indicate area of research interest during this process, during secondary application interviews or after acceptance? And when will we be able to change area of interest, since we aren't able to actually meet potential faculty?
You're going to be meeting potential faculty because that's the way we do our interview process. But generally speaking, many times you apply for particular programs. In our case, we don't care. We're taking the best applicant. That's the bottom line. So I don't care, but I cannot have a class of 7 cancer biologists or 7 neuroscientists or 7 tumor immunologists or microbiologists or whatever. So I do need to have variety in the class. But we don't pay attention to what specifically you're asking. Now, certainly as an applicant who has driven a particular set of research experiences, and let's say that you were inspired because of a leukemia in a close relative, and you started doing cancer research, and you did a series of activities. Certainly you're going to be selling yourself best as a future cancer biologist. But literally, you're in, I don't, if you want to change fields, that happens all the time. Okay. It happens all the time. Don't worry about it. You are a stem cell. Okay. You may be coming as an ectoderm, meaning already into neural tissue, but you can become skin or melanocytes, or something else. So, I mean, um, don't worry about many of those things. It's less relevant than having enthusiasm for the scientific process, for doing research, and taking care of patients of whatever related aspect that is. Now, if you change and you become an orthopedic surgeon, believe me, in an orchestra, we need great players in every single specialty. So it's, don't worry. We don't check specific boxes.
In our application, you will indicate the area of interest during the secondary application. That's exactly right. And just to note, our program in particular does not have a traditional secondary application. We do not ask for essays and we don't ask for additional fees. We use it primarily to do exactly this, just to ask additional questions about how we can personalize your interview process. For example, what research discipline do you see yourself going into at this time, knowing that this may change in the future, but at this time, what do you see yourself doing? We also ask you at that time if you have any food allergies and things like that for the on-campus interviews, but obviously we're going to need to change those sorts of questions and things like that. So, okay, so no more questions at this time. You can continue going on with the presentation, Dr. Cavazos.
Letters of recommendation. So, in general, we want letters of recommendation from any substantial research experience. So in general, that's defined more than 8 to 12 weeks. If you didn't get one from a particular summer, it's not a big deal. But missing a letter from someone that was more than 6 months can be a red flag. Now, if that person is unable to provide you a letter because that person is ill or has died or something along those lines happened, you need to get someone who was in the lab who is able to provide a letter of recommendation for that. In general, make sure that you waive your right to see that letter. Those are the letters that are valuable. If you do not waive your right to see a letter, those letters are seen as essentially written by you. Okay? No questions?
No questions.
Okay. If I am applying for MD PhD with MD consideration, will MD PhD application be considered complete when I submit AMCAS? Absolutely. Now, some schools use TMD SAS as a secondary. I believe that Houston does that, but that's not our case. If you apply to TMD SAS, great. If you don't apply, better in general. We obviously are looking for people who who are um, who are looking for a career as a physician scientist. So someone who is just applying MD PhD throughout, um, it's probably more valuable. For Texas residents, you want to have a plan B and have some MDs, to be considered. That's okay. Generally speaking, if you are a legit candidate that talks about research as part of your DNA, um, you're going to come across as truly an MD PhD. You're just covering your bases with MD applications. But, in the setting, so you need to convince us that if you were given the 2 acceptances, you will be taking the MD PhD acceptance. Whereas one person that is applying MD PhD only will already know that there's no other plan B. This is what they want. And so for committee members that are evaluating applicants, it's seen as a more legit, a stronger dedication to the career.
Dr. Cavazos, real quick, I've had a few questions asking about including experiences from high school. What would you recommend for that?
Experiences from high school, it's okay. We do know they are not the same level than one accomplish or does when they are in college, or when you are doing a postbac. Um, you know, that certainly is it's a more mature experience. You know, particularly if you end up, for example, doing a postbac at NIH. I mean, I love to recruit those kids. Every class has a couple of or more of NIH postbacs. Why? Because they know what they are getting into, and they are able to communicate that in the interview. So high school experiences, if you have them, sure, include them. They can be part of your narrative as to why you ended up doing and applying as you are. And certainly for people who are coming and applying directly from college, it's one other additional experience. So certainly that will be helpful. Um, any other question?
That's all for the private chat right now. Are there no
Anybody, anybody, just unmute yourself if you want to ask a question.
I have one question.
Okay, Isabel?
Hi. I was wondering, for the Chalk Talk, did you have any particular things you've noticed with students that really stood out to you, that they understood the research and communicated it well, that you might recommend?
Okay, so having done, you know, a little bit of research on that, I can tell you that people who have done presentations, particularly poster presentations, they do better.
Dr.
Okay.
Cavazos, do you want to explain what a Chalk Talk is? Maybe
Okay.
not everybody else.
So in our system, interview system, we ask students to do a 7 to 8 minutes presentation where you describe one project, one hypothesis, and what you are talking is doing like a a funnel introduction, like any manuscript will do, which is you start general and then you start going down and smaller, and then there is this gap of knowledge. To address this gap of knowledge, we came up with several theories and we formulated this hypothesis. Okay, to address this hypothesis, I developed this particular experiment, and what matters is not the techniques. We're not looking for technicians, we're looking for scientists. So it's more important to assess what kind of controls were you doing. Is the tech, you know, yes, the technique able to answer, the experimental design able to answer the hypothesis? And, you know, so I came up with this experimental design and I tested it. And, you know, we were able to answer the question. And, you know, certainly if it is a fancy answer, it ends up typically in a manuscript. But if ends up in a negative, you still answer the hypothesis. What we care is that you went through the scientific process and you practice and you practice and you practice. You know, I'm a physician scientist in epilepsy. I sell epilepsy ideas, okay? Ideas to the NIH, to the peer review process, to the public, to my deans. You know, is this gonna be a fundable thing, program? Okay, I'm gonna give you some startup package. You know, So that's how you do this. We are salesmen of ideas. So we need to communicate and articulate in a very succinct and, you know, very articulate manner these ideas. And so that's part of our job. What we do as physician scientists is we do write papers. Okay, that's what we leave behind. And we ask and write grants so that we can write more papers. So the grants allow us to do papers. But those two skills, papers and grants, are one of the things that we excel. And we excel by being one of the top programs in the nation, you know, by the number of NIH fellowships, by the number of manuscripts that our students publish. And so the Chalk Talk is a brief piece that is examining how good can you communicate. And, you know, there are, you know, you are being compared against the last 500 Chalk Talks that I have heard. So you're not really running against each other. You're running against my memory of what I have seen. And we have in the room one person, you, giving the Chalk Talk, and then we're going to have virtually probably 7 to 10 people who have heard Chalk Talks from the entire year. And so you get an idea of what this number and score is, and that's another score. And so we use an academic score, we use an interview score from the multiple one-to-one interviews, and then we do a one-to-one, I mean, this Chalk Talk, and we average them, crunch the numbers, and we have an initial ranking thing for the committee. And then the committee says, no, 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 this is too low. This is because, you know, it interview with a series of very hardcore people. Let's push this person up. And, you know, that's how we do the sausage. And we end up, you know, coming with a list in terms of how to give acceptances. So for us, and about 10 programs in the nation, this is an important thing if you are interviewing. You know, so it is useful in the end when you are interviewing in other places. Instead of doing 7 minutes, 7 to 8 minutes, and then 3 minutes for questions and answers, you are actually giving the Chalk Talk in pieces, because they ask you, what is your research? And so you have to spit out anyway some of these things. Now, we don't want to hear a litany of, I have done these studies and I have done these other studies, and I want one project, one hypothesis. I want to see whether the wheels are moving. And again, we don't care. I don't need to hear about Western blot and how it was done. I want to understand why a Western blot was used.
Thank you.
Another question on the Chalk Talk. Does the research project have to be designed independently, or is it something that they could have developed within a group?
So, you know, you are not a finished product. You are a student that has been given the opportunity of working together in a particular group. And part of the reason of the questions and answers is to understand how much do you understand out of what you said. So no, it doesn't, I mean, we know that the PI may have played a major role in designing the experiment, but we want to hear something that you did, not something that somebody else in the lab did and you are trying to describe. We want to say something that you participated. Other questions?
So we only have a few minutes left. So if you have any more questions, please submit them now and we'll try to get to them. But just FYI, we are going to continue this webinar as a series. So we would definitely hope that you can tune in and ask any follow-up questions at that time as well. We have a question that says, I have worked in a physics lab since freshman year and have only worked in a medical center lab for 1 summer. Would it be better to present the physics research, I guess, yeah, for the Chalk Talk, or more medically related research during the Chalk Talk?
You do what you feel most comfortable with, okay? We're gonna be asking you questions. Some of the better Chalk Talks that I have heard have to do with nothing biological, you know, chemistry or social sciences. But they were elegantly designed, and the applicant understood why that particular design had to be used and was able to defend the design. And that is what we're looking for the insight. So we have had people, in fact, one of our graduates who her research experience was a summer project at CERN in Switzerland, and was working in the, I believe it was the Atlas Collider, and was trying to explain, you know, one particular project to a bunch of biologists. And, but she was able to communicate that in a very good manner. So that's what we're looking for. She's now a neurosurgery resident at University of Virginia, and finished her PhD in 3 years. I mean, she was so sharp despite coming from a very different point of view. Well, thank you for taking time.
One last question, sorry.
Sure.
I was on mute. Someone asked, can 2 of the 3 letters of recommendation come from the same research experience? For example, like the PI and the postdoc from one research lab?
Well, certainly, if that's all you have, that's all you have. We want people who are familiar with you, and tell them what you are applying for. You're applying for becoming a physician scientist. And so one of the things that we want to have in the discussion in a letter is your potential as a future scientist. So that's one of the things that matters the most. Do you need to have the letters from your chemistry professor? I mean, some schools require them. You know, to be honest, they are useless. You already have a grade, and they often comment, this person got a particular grade, and she was the, number 2 out of, 20, students. Well, it may mean something if it is number 2 of 500 students. So, but realistically, it's not, a major thing. So I'd rather have, labs in a senior thesis, obviously, or that's a project, a product. And so that's certainly the mentor for that should be one of the letters. So the answer is yes. If that's all you get, that's what you get. I mean, these are flexible times, but people will know that both letters are tied together. Now, if that's the only research experience, but it was a very depth research experience, the more research experience, the more we expect. We expect more ability to have posters or manuscripts, if you have spent 5 years in a lab.
Okay, that's all the questions we have for tonight.
Okay, so thank you again for joining us and giving us an opportunity. We look forward to see your applications. sometime in the near future. You can contact us before you apply regarding your applications, and whether to give you advice regarding this part or that part. Once you submit, well, it is submitted. So I wish you the best. You guys are my eventual replacements. So, we are really interested in making sure that you guys do you get into these programs, and you are able to fulfill what it's desire, which is to be the innovators of healthcare and research and biomedical discoveries to improve health. So thank you for being here, and I look forward to be reading your applications. And believe me, this is a terrific program. My students are really, really happy. And so, if you haven't, we probably will add one with just the students to give you an opportunity to do that. Thank you. Have a good one. Bye-bye.